Please like, subscribe and hit the bell icon.
Hi guys, welcome back to the channel. Today we discuss the physiology previous year question paper from 2019 to 2024 Meditalk by Dr. Bhushan. Please like, share and comment and subscribe to my channel for various.
This video is for educational and informational purposes only. The exam patterns, formats, and tips shared are based on publicly available information, personal analysis, or experience, and are intended to help students better understand how exams may be structured. I do not represent any official examination board or institution unless explicitly stated. Exam formats and requirements may change over time. Always verify with the official website or source for the most up-to-date information. The strategies and insights shared are general in nature and may not apply to every individual's situation. Viewers are encouraged to use this information as a supplementary guide and always refer to official notifications or trusted academic advisors. By watching this video, you acknowledge that it is meant to support your learning, not replace official guidance.
Videos. First, August 2019, paper 2, physiology, 3 hours time for 50 marks. This is the old pattern. First is AC question. AC question describe the optic pathway from the photoreceptor to visual cortex. Add a note on visual field effects produced by which lesion at a various level of the pathway. This is a 10-mark question. Second, write notes on Brown-Sequard syndrome, histotoxic hypoxia, physiology of fetal circulation before and after the birth, special feature of coronary circulation, season descent. Third is a short note answer. Implicit memory, stages of sleep cycle, denervation of hypersensitivity, determinant of force of contraction of heart, Bohr effect, jugular venous pressure, GVB, endogenous opioids, mouth-to-mouth respiration, heart block, and respiratory distress syndrome in newborn. Part 1 from August 2019. First is a discuss the molecular basis of skeletal muscle contraction. Add a note on trigger mortis for the 10 mark. Second, write short note on complement system of antibody action, non-excretory function of kidneys, glucose transporter, step in spermatogenesis, erythroblastis fetalis. Section 3, apoptosis. Second is a function of aldosterone, megaloblastic anemia, filtration fraction, gigantism, atonic bladder, absorption of carbohydrate in food, mast cell, milk laid down reflex, and shape of erythrocytes. You can download this paper from firstranker.com. We thank for this paper and we are discussing. Next, August 2020. First paper. Essay question was describe in detail mechanism clotting of blood, intrinsic and extrinsic pathway. Then write notes. Second part, factor affecting the glomerular filtration rate, maturation reflex, function of growth hormone, negative feedback mechanism, peptic ulcer. Third, short note answer. Refractory period, enteric nervous system, name 4 GI hormones, cretinism, diuretics, function of placenta, LH surge, gallstones, function of platelet, and motor unit. 2020 part 2, paper 2. Describe the neural regulation of respiration. Add a note on periodic breathing for the 10 marks. Factor affecting the cardiac output, pacemaker potential, ECG lead to, auditory pathway, and function of cerebellum. Third part, lung compliance, exchange vessels, function of parietal lobe, waves of EEG, referred pain, cardiac rhythm, aphasia, Cloer-Bucky syndrome, homonucleus, sensation carried by posterior column for the 2022 paper 2. Essay question, trace the visual pathway with a neat diagram. Add a note on visual field and defects produced by lesion at various levels of pathway. Section 2, write notes on paradoxical sleep, fetal circulation, diabetism, function of cerebellum, short-term regulation of blood pressure. Third part, Hamburg shift, Raynaud's numbness, define anosmia and mention two causes of anosmia. Refer pain, name to facilitate anxiety neurotransmitter. Bohr effect, this is repeated question. Bohr effect. Draw neatly waves of ECG, solitary conduction, dead space of lungs and law of projection. August 22, paper 1. Essay question, define the hemostasis. Describe the various stages involved in the coagulation of process. Add a note on anticoagulant. Genesis of resting membrane potential, function of insulin, stages of deglutination, classify transport across the cell membrane, and write briefly about the active transport and a cystometrogram. Third part, aldosterone escape, function of large intestine, draw and label neatly parts of sperm, positive feedback mechanism with example, type of skeletal muscle, type of T cell, steatorrhea, Sheehan syndrome, aquaporins, and difference between the acromegaly and gigantism. May 2022. Too long question. Part 3 was cancelled. First is define the cardiac output factor regulating cardiac output. Discuss one method for measuring the cardiac output. Discuss about the nuclei, connection, function, and basal ganglia. Add a note on Parkinson disease. First is a cardiac output and second is a Parkinson disease. Short notes. Second part is a pain pathway, composition and function of CSF, respiratory membrane, periodic breathing, features of hypovolemic shock, non-respiratory function of lung, muscle spindle, anterior spinothalamic tract, intraocular fluids, and renin test and its significance. From 2022, University changed the pattern with the 20 marks MCQ and 80 for the theory. Feb 2022. Explain detail about the conduction system of the heart. Add a note on action, potential of ventricular muscle and pacemaker. Classify the synapses. Mention the various properties of synapses. Add a note on central neurotransmitter. Second short note, intrapleural pressure, ODC curve, renin-angiotensin system, photoreceptor, tract of Goldberg, refer pain, Berger rhythm, jugular venous pressure. This is also repeated. Fetal circulation also repeated. Auditory pathway is also repeated question. March 2023. First essay question, mention various steps in hemostasis. Explain the detail how bleeding is arrested through intrinsic system of coagulation. Add a note on hemophilia. This is a second question in essay question. Second, name the different hormones secreted by isolate of Langerhans. Explain in detail about the chief hypoglycemic hormone. Enumerate the consequences of insulin deficiency. This is a second question. Write short notes on primary active transport, indication and complication of blood transfusion. This is also repeated question. Blood transfusion and complication. Describe the structure of sarcomere and contractile protein. This is also repeated. Myasthenia gravis 100%. This is important question. Explain in mechanism of gastric secretion, intrahepatic circulation, Cushing syndrome, mechanism of evolution, autoregulation of glomerular filtration rate and renal blood flow, transfer characteristics of late distal tubules and cortical collectivity, CT and TCT. March 2023. Part paper 2, 20 marks for MCQ, 80 marks for theory. First is the define the blood pressure, systolic blood pressure, diastolic blood pressure, describe the short-term regulation of blood pressure, explain the vasovagal syncope. Trace the visual pathway. This is also repeated question. Trace the visual pathway. Describe the disorder of visual field in the relation of visual pathway. Lesion on the track. Short notes. PR interval in ECG. This is also repeated. Regulation of cerebral blood flow. Compliance of the lungs. Hypoxia. Organization and function of respiratory system. Analgesia system. NREME. REME. Sleep. rapid eye movement sleep or non-rapid eye movement of sleep. Difference between taste pathway, function of middle ear, and classification of memory. This is also repeated question on memory. Jan 2020-23. Here change the pattern of the question. They add a clinical history. Do not panic about this question. First read the question. A 60-year-old man who is a smoker and diabetic was brought to the emergency department with a complaint of retrosternal pain radiating to the middle side of the left arm on exertion, palpitation, sweating, and shortness of breath. What is the likely diagnosis? The peculiarities and regulation of coronary circulation. You have to write about the cardiac cycle, coronary circulation, and add a note on cardiac biomarkers specific to the above said condition. This is a long question. Second is a describe the various respiratory center. Discuss in details about the neural regulation of respiration. First is a cardiac and second is a respiratory. Both systems are covered. This is an important question. Short notes. Describe the left ventricular pressure change in cardiac cycle. This is also related to this. Factor influence the venous return. This is also mechanism of CO2 transport in blood. This is also respiratory. What are the non-respiratory function of lung? Mention the difference between REM and non-REM sleep. This is also repeated question. What is the Brown-Sequard syndrome? This is also repeated question. Write its clinical feature. What are the function of hypothalamus? This is important. Trace the olfactory pathway. Mention the taste of hearing and write short notes of error of reflection. January 2020-23. Paper 1. Physiology. Define the immunity. Classify different types of immunity. Explain in detail cell-mediated immunity. Add a note on true killer cell. Describe how countercurrent mechanism in kidney operate to produce hypotonic urine. Add a note on diabetes insipidus. This is a too long question. Second part, sodium potassium ATP pump, hemolytic anemia, glucose reabsorption in nephron. Explain the structure of smooth muscle and its property, body fluid compartment, phase of gastric juice secretion, dietary fibers, neuroendocrine reflex, role of vitamin D in calcium hemostasis, mechanism, action and function of testosterone. November 2023, paper 1, Physiology on CBME pattern, 100 marks, 80 for theory and 20 for MCQ. Here also add a clinical scenario. First, read the question. A 45-year-old male complains of epigastric pain for the past 3 days. History reveals taking on and off painkiller over the counter. What is your diagnosis? Illustrate the microscopic anatomy of gastric glands. Explain in detail about the mechanism of secretion of hydrochloric acid. Add a note on acid peptic disease. This is a question on acid peptic disease. You have to read written for SCL secretion and regulation, EPI. Second, describe the major ovarian process that occur during the pre-ovulatory period. Name 3 effects of estrogen on the pre-reproductive tissue. List the indicator of ovulation. Discuss about the precious puberty. This is a 2 question in 1 question. Second part, feedback mechanism maintaining the hemostasis. Repeated question. Classify various body fluid compartment, fluid exchange and osmotic equilibrium between the intracellular and extracellular fluid. ECF or ICF. Megaloblastic anemia, erythroblastus fetalis. Describe the structure and sarcomere contractile proteins. This is repeated question. Defecation reflex, action in chief hypoglycemic hormone on liver, skeletal muscle and adipose tissue. Maturation reflex, repeated question. Write in brief about doctor-patient relationship and function of placenta. September 2020-24, CBME Pattern supplementary papers 80 for the theory, 20 for MCQ. Essay question: name the different blood groups, system and their importance. Describe about the ABO glode. Add a note on transfusion reaction. This is also repeated question. 45-year-old female came to the OPD with the complaints of lethargy, cold, intolerance, weight gain, constipation. On examination, swelling in the neck region with a facial puffiness were noted. What is your probable diagnosis? Discuss the synthesis and function of hormone involved and creatinine. You have to write about the thyroid hormone and diagnosis. Second part, write short notes on secondary active transport, properties of smooth muscle, second stage of deglutination, exocrine function of pancreas, glucose transporter, parathyroid hormone, fetoplacental unit, neuroendocrine reflex, resting membrane potential, principle of communication. January 2024. There is also clinical scenario. First is a 50-year-old male went to the visit to Shimla. On reaching there, he experienced a difficulty in breathing, complaints of headache, show sign of altered sensorium. What is your mostly likely problem he experience? What are the different types of above condition? Write about the its feature and management. And second is a trace the visual pathway and neat diagram. Write about the effect of lesion at various levels in visual pathway. This is a repeated question. Guys, this is an important question. Make them sure. Second, short notes. What are the baroreceptor? Write role on baroreceptor, regulation of blood pressure. Write note on triple response. Define the cardiac output. This is also repeated. What are the method measure the cardiac output? What are the different types of artificial respiration? Explain in one detail. What is the surfactant? Mention in its function. What is aphasia? What are types of aphasia? Write in detail about the function of cerebellum. Explain about the formation, circulation, function, cerebrospinal fluid. Draw structure, organ of corti. Mention its in role of hearing. What are the theories of color vision? January 2024, MBBS, paper 1, Physiology, 80 for theory, 20 for MCQ. First question was explain mechanism clotting via intrinsic pathway, differentiate between the coagulation and bleeding disorders. This is also repeated question on blood clotting, intrinsic pathway or extrinsic pathway. Describe the renal mechanism excreting the concentrated urine. This is also a repeated question. Add a note on nephrogenic diabetes insipidus. Write short notes on diabetes insipidus. This is also repeated question. Write short notes on intracellular communication, primary active transport, gastrin, function of liver. Write about the importance of empathy and attitude in patient care, sympathy and attitude in patient care, action of cortisol. Compare the metabolic action on insulin and glucagon. This is also repeated. Milk ejection reflex, human chronic gonadotropin ECG, movements of small intestine, and also a one question, function of large intestine. August 2020-24. First AC question, write about the respiratory center. This is also repeated question, guys. Explain in detail about the chemical regulation of respiration. Add a note on periodic breathing. Second is a 65-year-old man was brought to the OPD with the chief complaint altered gait, difficulty in speech, and difficulty in coordinating the movements. On examination, difficulty in performing the test for coordination and pendular knee jerk was noted. Is the site of lesion? Describe the connection, function on structure involved. What is the dementia? Dysmetria. Peculiarities of corneal circulation, compliance, reticular formation, blood-brain barrier, factors which regulate the heart rate, decompression sickness, function hypothalamus. Define the law of Laplace, mention its application, respiratory system, fetal circulation, broad receptor potential. Next is the last paper, August 2024, last year paper, Physiology. This is also repeated questions. Define the immunity, describe in detail about the cell mediated immunity, add a note on autoimmunity. 45-year-old man attended surgical OPD with a chief complaint of passing bulky, frothy, and foul-smelling stool. Name the above condition, describe composition and function of pancreatic juice, write a note on acute pancreatitis. Second part is how is the fluidity of blood maintained inside the blood vessel, intrahepatic circulation, sodium potassium ATP sperm, role in Indian graduate as a communicator, test of ovulation, what are the mineral corticoids. This is also repeated question. Add a note on aldosterone escape, factors affecting the glomerular filtration rate, function of platelets, negative feedback mechanism, function of posterior pituitary hormone. Thank you guys. Thank you first www.firstanchor.com, and please like, share and comment and subscribe to my channel. Thank you.